In this video, we're going to talk about the scope of practice for our natural nutrition coaches from the Health Coach Collaborative. So depending on the industry that you're in, for example, Heather is a fitness professional as well as a natural nutrition coach. And so for her, she's got two different scopes of practice, but we just wanted to make it very clear what a health coach or a natural nutrition coach from our program is allowed to do and how they can practice.
To begin, the scope of practice is very specific and it outlines what we can do, what we can say, what we cannot do. To start, we don't diagnose. We are not doctors. We are perhaps recognizing imbalances or even deficiencies, but we also have to, although we're thinking that this might be a specific deficiency, the way that we relay this information to the people we're working with has to be described in a specific way, that it's not perceived as a diagnosis. Only a doctor can diagnose. We refer to other professionals when something is outside of our scope of practice. And we also don't want to be misconstrued or perceived as dietitians because they have a different scope of practice. They practice very differently. We stay in our lane, they stay in their lane. So the way that we approach nutrition is general in the sense that the nutrition that we are helping people with is intended to improve their lifestyle, their health, to help them streamline and make their cooking preparation, meal preparation more efficient. So it's a little more lifestyle based rather than diagnostic. And this is clearly outlined in our scope of practice, which is essentially our list of do's and don'ts.
I could give an example too from our coaching perspective. If you're talking with a client, and a lot of times in the assessment and our assessment appointments, so sometimes people will do a blood pressure. They'll take the blood pressure and they'll do other non-invasive tests. That's the other thing. We don't do anything invasive. Everything is non-invasive. So say you want to take blood pressure for your client and you look and you find that, oh, it's up over 140. The systolic pressure is up over 140. Maybe it's in that hypertensive range. We can't, as a coach, say, hey, you're hypertensive. These readings are indicating you're hypertensive. What you can say or what you can do is show them a chart that has the range of the blood pressure numbers, and they can see for themselves, oh, they're in this area. And you may make a recommendation or a reference to go and see their healthcare professional. You can provide them with the numbers and they can have that. So as a coach, we don't say, hey, you're hypertensive. We can say, hey, here's a chart. Have a look. You're in this range. The numbers are showing in this range. Maybe you may want to go and see your healthcare provider.
I think it's important to say that nutrition coaches take into account, let's say, stress levels, sleep habits, medical history, current medical conditions, their eating habits, and other lifestyle factors like family and all of those things like finances that can come into play that may be holding somebody back from reaching their goals. And some of the questions or approaches that they take might be slightly different. Everybody has a style of coaching or a different way of approaching their practice, but a nutrition coach typically will discuss, food related or lifestyle related topics, including, what you typically eat in a day, if you follow a specific way of eating like veganism or vegetarianism, whether you have allergies, variety in your diet, are you good at cooking, what kind of things you drink, all of those things. And so I think those are some of the factors that you can be looking for. And of course, there's differences between a nutrition coach and a registered dietitian. And we can cover some of those differences now. I think that makes sense. The first thing I want to start with, and you guys can follow up, is there's lots of different names for nutrition coaches that are not registered dietitians. things that you're going to hear or may be looking for, or are nutrition coaches, nutrition consultants, certified nutrition practitioners. And then when it comes to a registered dietitian, you're going to hear registered dietitian or registered nutritionist, I think is another one that's pretty common. And so a nutrition coach is the most flexible term. And Lisa, you were talking about this just before, and so maybe you can, say why it's the most flexible term.
Well, in every province or state, regardless of what country you live in, registered dietitians they have a very clear scope of practice, and there is not much flexibility with the work that they're able to do. So depending on where you live, you may or may not be able to use the term nutritionist or even the term nutrition or diet in your designation or even in your work, in some very extreme cases. The term coach, however, doesn't have any regulations tied to it yet. I mean, it may come down in the future, but at the moment it is a very flexible term to use. So if you are practicing nutrition counseling, or if you're writing or working with an organization doing any kind of nutrition related work, using the term coach is a safe term to use, so you're not crossing over into dietitians territory. The word nutritionist is a little bit contentious in some, for example, we're in Canada, and in some provinces in Canada, people can use the term nutritionist if you're a holistic nutritionist, or if you're certified or registered, but not in certain other provinces. However, you can use the term coach safely across all provinces, and I believe it's the same in the States. Dietitians specifically are, again, in some cases, only able to practice in their own state or city, and they are not allowed to do any kind of work outside of their state, even if it's online or remotely. So again, a lot of the work that you can do depends on where you live, if you are in that if you're in that professional role. But if you add coach to your name, then it gives you a lot more flexibility, and it's a really good option for anybody who wants to incorporate nutrition counseling into their work.